Good afternoon. I'm Eric Commandant, Vice President of Federal Affairs at the Association for Accessible Medicines.
And I'm Michael Brzyzka, Vice President of Federal Affairs at AAM as well. Welcome to Washington, D.C.
We just saw the President outline his plan to lower prescription drug costs. Michael, what do you think?
I thought it was a good speech, Eric. I think the President talked a lot about the positive role that competition plays in lowering the price of prescription medicines. When he talks about competition, frankly, that's about our industry. Generics are on average 85% less expensive than their brand parents, and for some of these drugs you can see savings of upwards of 90 or 95%. So the value of competition was clear, and I think the President's plan moving forward will underscore the goal of increasing that competition to the benefit of patients.
It was great to hear the President talk about some of the abuses that occur with FDA safety rules and the patent system that make it harder for generics and biosimilars to come to market, and to have that level of attention on such, I think, an egregious practice is really welcome.
Yeah, I thought so too. The President in particular, he made one statement that I think was really solid. He said about the patent system that, quote, "It will not be used as a shield to protect unfair monopolies anymore." This is a problem that our industry has really struggled with a lot. As you know, the drug Humira, it went off patent in 2016, but the company that created that drug filed an additional 100 patents that, if left unchallenged and kept in place, would extend that company's monopoly till 2034. The fact of the matter is patent gaming is a real problem, and I think it's great that the President has said his administration is going to take that problem head on. The issue of reducing copays for American seniors.
So that is, I think, one step that the President had outlined in his budget back in February. Reducing copays for generics and biosimilars in the Medicare Part D program for low-income seniors will encourage seniors to use generics when available and really save them money at the pharmacy counter. So it's a great proposal that we hope that Congress and the administration will work to enact.
What do you think we've got in front of us in terms of next steps?
So now that the President has made his speech and outlined the blueprint for reducing drug costs, Secretary Azar will follow up a speech on Monday where I think he'll provide a little bit more detail about exactly how they intend to implement a number of these policy proposals. There'll be a 30-day comment period where I think all stakeholders will focus on which of these policies need to move forward, and we, of course, will be commenting as part of that process, too.
Right. The administration released just before the speech a 44-page request for information to the general public entitled, quote, "American Patients First," and I really think that's going to be the underlying goal of what we see out of this administration moving forward. The need to really increase access to more affordable medicines, increase the positive role that competition plays in bringing down those costs, and ensuring patients have access to safe, effective, and FDA-approved generic and biosimilar medicines.
That's it for us here this afternoon. Thanks for tuning in.
Thanks, everybody. Have a great weekend.